Hi, my name is Lindsay. I'm going to be doing a head-to-toe assessment on my patient who just had a laparoscopic cholecystectomy, which is removal of a gallbladder. When I enter the room, I'm going to be doing hand hygiene and a 60-second situational awareness. First, looking at my patient, making sure his airway, breathing, and circulation looks okay. No abnormal coloring, no unlabored breathing. Make sure the bed is in the lowest position. Any environmental hazards that could cause him to trip and fall, since he has a fall risk because he will probably be on opioids, and he just had surgery. Also checking my emergency equipment, making sure my oxygen flow meter, Christmas tree, ambi bag, suction canister, and tubing is all there and readily available if we were to need it. Hi, my name is Lindsay. I'm going to be your nurse today. Can you tell me your name and date of birth?
Oscar Blatas,
What's your date of birth?
08/24/99.
Perfect. Do you know where you are right now?
Yes, I'm at Grossmont College.
And do you know the month and the year?
Yes, August 2023.
August 2023. Perfect. Patient is A&O times 4. I will do hand hygiene and put on gloves before I inspect his surgical site. Also, in my 60-second situational awareness, I would also be looking for any signs and symptoms of external bleeding or hemorrhaging, or abnormal distension in his abdomen area. And we're back. So, have you had a bowel movement yet?
I haven't.
Okay. Have you been passing any gas?
I have been passing gas.
Okay, perfect. So you are 1 day post-op, so it is to be expected that it might be a little slow moving in there. So we're gonna make sure that you're drinking a bunch of fluids. I also took his vital signs, and they are all within normal limits. No signs of infection. Are you in any pain right now? Scale of 1 to 10, what's your pain level?
1.
A 1? Okay, and what's your tolerable amount of pain?
A 3.
A 3? Okay, we'll try to keep you at under a 3. It is to be expected you might be a little bit uncomfortable due to the surgery. Okay, so I'm going to inspect his incision sites for any angry looking surgical sites, any abnormal redness, any drainage that is abnormal in color. They all look okay and clean and good. I would then listen to his bowel sounds, starting in the right lower quadrant. I would be here for 15 seconds to 2 minutes, given he hasn't had a bowel movement, so I just want to be sure that his bowels are making noise and sounds. Things are moving along down there. I would move up to the right upper quadrant, same thing. Moving over to the left upper quadrant, same thing. Left lower quadrant. And from here I would palpate, and I would be watching his face for any grimacing. Are you in any pain right now?
No.
Okay.
Just a little tender right there.
Tender, yeah, that's to be expected a little bit, but if it gets uncomfortable or unbearable, please let me know, and I'll also palpate his bladder. Are you urinating okay?
I am.
Okay, there's no burning sensation, foul odor, foul color,
Nothing
or
of that.
abnormal color? Okay, I'm gonna go ahead and start at your head now. I'll do hand hygiene again. Take off my gloves, hand hygiene. I'll assess for any lumps, bumps. Can you lift up your head? Okay, you can lift it down. I'll be looking for any pressure ulcers. If he had an oxygen, I would be checking for pressure ulcers on his ears. Can you look to your right for me? Any JVD? That was your left. Now look to your right. I'm sorry. Any signs of JVD, which he's okay. Can you tilt your chin up? Any signs of tracheal deviation? They're okay too. Skin turgor's good. I'm going to be, can you puff out your cheeks for me? Can you give me a big smile? Frown? Raise your eyebrows? Perfect. Face is symmetrical. I'm going to be looking at your eyes now. Pupils are round and equal, and they're about a 4. I'm going to be shining a bright light in your eye. I'm looking for consensual pupillary response right now. Make sure he's on opiates right now, so I'm making sure his pupils aren't too constricted, because that could be a sign of potential overdose, but he's talking to me right now too, so that's another positive sign. I'm gonna have you look at my pen. Can you look over my shoulder? Perfect. Eyes are accommodating and responsive to light. Okay, I'm going to go ahead and listen to. You have any blurred vision or headaches?
No.
Any ringing in your ears or loss of taste or smell?
No.
Okay, perfect. I'm going to be listening to your heart and your lungs now. Have you had any chest pain? Are you on any cardiac medication that I should know about?
No.
Any trouble breathing?
No.
Are you a smoker?
No.
Okay, so I'm going to go ahead and take a listen now. I'm going to start at the second intercostal space, left sternal border. I'm listening to the heart. This is going to be the aortic area. I'm moving across the second intercostal space, left sternal border, listening to the pulmonic, moving down the left sternal border to the third intercostal space, listening to the Erb's point, which is where I could probably hear any murmurs, moving down to the fourth intercostal space, listening to the tricuspid, moving across to the fifth intercostal space, mid-clavicular line, where I would listen to his apical pulse for 1 full minute. And I'd also like to note that I would typically be doing this underneath clothes, but for video purposes, we're keeping it PG. I'm now going to be listening to his lungs. I would start at second intercostal space, mid-clavicular line, listening to the left upper lung, moving across the second intercostal space, the mid-clavicular line, listening to the right upper lung, moving to the fourth intercostal space, listening to the right middle lobe, moving across the fourth intercostal space, listening to the middle of the left lung, moving to about the 10th rib, halfway up the upper arm, anterior axillary line, listening to the lower left lung, doing the same thing on the right side, right lower lung, halfway upper arm, anterior axillary line. I'm going to go ahead and have you turn over, and I'm going to listen to your lungs on the back side. While he's here, I would assess for any pressure ulcers on any bony prominences, coccyx, elbows, shoulders, heels of his feet. Now I'm going to be listening to his posterior lungs, starting at the spinal border, right lower lung, moving across to the spinal border, left lower lung, moving across to the posterior axillary line, listening to the lower left lung, halfway between the upper arm, moving over to the right side, halfway between the upper arm, listening to the right lower lung, moving up to the bottom side of the inner scapula, listening to the middle of the right lung, moving over to the inner side of the scapula on the bottom, listening to the left of the middle lung, moving up to the top of the inner scapula, listening to the top of the left lung, moving over to the right top of the inner scapula, listening to the right top lung. Perfect. All right. Can you go ahead and roll back flat for me? I'm going to be touching your extremities now. Can you feel my arms or my hands? I'm sorry.
Yes.
Any pain?
Nope.
Okay, skin is dry and warm to the touch. I'm going to be listening, and it is appropriate for color is appropriate for ethnicity. No puffiness. I'm listening to his pulses. They are bilaterally equal. Do you have any numbness or tingling?
No.
Okay, and cap refill is less than 3 seconds. That's perfect. Can you squeeze my fingers? Can you pull me towards you? Can you push me away? Strength is bilaterally equal as well. In his upper extremities, can you feel my hands?
Yes.
Are you in any pain?
Nope.
Okay, same thing. I'll be assessing for the color of his skin. It's dry and it's warm, appropriate for ethnicity. Check his posterior tibialis. Normally his socks would be off, and they are bilaterally equal. Dorsal pedis, again, bilaterally equal. I would check capillary refill, less than 3 seconds. Can you drive the car? Oh, also, is there any numbness or tingling down here?
No.
Okay, can you drive the car? Okay. Can you point your toes to the sky? Strength is bilaterally equal. That's perfect. Perform hand hygiene. No. Yeah, perform hand hygiene. Do you have a good support system at home?
I do.
You do. So when you leave here, you're going to have somebody be able to help you and take care of you?
Yeah, my wife.
Oh, love that. Okay, awesome. If you need anything from me, I'll be coming and checking on you in a little bit. Until then, I'm gonna have you drink a lot of fluids because I know you haven't had a bowel movement. And are you able to walk yet? Walk around?
With the walker.
Okay, so I'll come back, or I'll have somebody come back and help you, and we'll get you walking around and moving, because that's gonna be one of the best things you can do to get things moving along in your body. All right? Okay, I'm gonna perform hand hygiene, document, and I'm done.